Hello, my psychology capstone project is on attitudes towards vaccines and intentions to vaccinate kids against COVID 19. My name is Kayla Orr. Although fewer kids have been affected with COVID 19 compared to adults, children can still be affected with the virus that causes COVID 19, get sick from COVID 19, and spread COVID 19 to others. Introduction. The CDC recommends everyone 12 years and older should get a COVID vaccination to help prevent against COVID 19. Widespread vaccinations is a critical tool to help stop the pandemic. People who are fully vaccinated can resume activities that they did prior to the pandemic. Children 12 years and older are able to get the Pfizer BioNTech COVID 19 vaccine. Previous research. Research has shown that the Pfizer BioNTech COVID 19 vaccine is 100% effective in preventing the COVID 19 virus in children ages 12 through 15. Research previously has shown that the vaccine is 95% effective in preventing the COVID 19 virus with symptoms in people ages 16 and older. The decision of parents involving childhood immunizations affect not just the overall administration rates in compliance, but also in potentially minimizing errors related to the COVID 19 vaccine. Among the biggest contributors to parents' decision making are their health practices and general knowledge about the immunizations. This just means that how parents are teaching their kids how to wash their hands and wear masks and stay 6 feet apart is very important. Also, with getting the vaccine and just their health practices in general. Not only that, their prior knowledge coming into the survey, what they think about immunizations in general affects what they will do with their kids as far as getting the kids the vaccination or not. Hypothesis and theory of planned behavior. My hypothesis is the intention for kids to vaccinate. It is because of this hesitancy of parents that we will be conducting a survey utilizing the theory of planned behavior in order to measure parents' intent in getting their kids vaccinated against the coronavirus, or if they would allow their children to receive a booster after a year of being fully vaccinated. The goal is for people to allow the targeted health behavior by allowing kids to get vaccinated. According to the theory of planned behavioral model, places that they should have faith in a positive outcome. The theory of planned behavioral or TPB model must believe in the positive consequences of their behavior, perceive familiar and societal pressures to participate in the behavior, and believe that participating or carrying out the behavior is within their control. positive correlations with individual attitudes, for example, would be, I believe that the COVID vaccine is effective. Social norm examples of this would be, my family thinks I should get the COVID vaccine. And perceived behavioral control examples would be, I have time to get the COVID vaccine, are associated with greater intentions to complete the health behavior. Therefore, this study seeks to evaluate the general public's intention to receive 2021's COVID vaccine using the TPB model. Method and participants. For the method, a survey link was given to parents on Facebook, Reddit, and other platforms, asking individuals if they would be interested in completing a survey indicating if they would be willing to vaccinate their children. Participants will be from the United States and are expected to range in age, race, and gender, as the survey will be conducted by parents of minors in different states. None of the participants will be given an incentive for completing the survey. It should take no more than 10 minutes to complete the study. Participants will be directed to the final page after attitudes towards vaccinations and intentions are completed, which will contain information needed for a debrief and thanking them for their time. These are my result sections for attitude, P, B, C, norms, and intentions. Overall, I had 16 people who clicked on the survey, but only 14 were taken and put into a data collection called Jamovi to test the hypothesis. Attitude, perceived normative pressure, and PCP was combined to predict intentions significantly for kids to get the COVID-19 vaccine. A multiple linear regression was conducted. Mean of attitude was 3.83, and the standard deviation was 1.81. Consistent with the hypothesis, the regression was statistically significant. The model accounted for a large percentage of the variability in behavioral attentions. R2 equals 0.94. Attitude was 8.3. And P greater than 0.001 was a strong predictor. And perceived normative pressure was 0.03, and P greater than 0.0837 was also a significant predictor. However, PBC was not a significant predictor of intention, which was negative 1.3, and the midpoint for this was 4. The complete regression results are presented in Table 1. According to the slide, attitude was the most predictive, according to the survey. The attitude of the people who took my survey was very important if they were going to give their kids a vaccine or not. The description, statistics, and correlation among the TPB measure are displayed in Table 2. Initial inspections of these results indicated that mean attitude, perceived normative pressure, PBC, and other intentions were unfavorable towards getting the COVID-19 vaccine. This is the last slide, and this is the discussion section. This study sought to examine if parents are willing to give their kids the COVID-19 vaccine. This was a failed experiment because the sample size was minimal, and it is not enough data to make a conclusive opinion if parents are for or against the COVID-19 vaccine for kids. The following data stated that the mean was 3.83, which means parents had a neutral attitude towards the COVID-19 vaccine. The low acceptance level of the COVID-19 vaccine among parents can be dangerous in ending the pandemic as a whole. An important factor to consider when exploring vaccine acceptability is vaccine convenience. Convenience in terms of its availability and affordability. As we know, the vaccine is free, but there can be issues getting there. That's why Uber has partnered with CVS and Walgreens to make transportation possible. With the new Delta variant, it is more important now than ever to get both vaccines to protect your family members and loved ones. A major concern right now is the Delta variant. It is highly contagious, which was first identified in India in December. It then swept rapidly through the country in Great Britain as well. The first Delta case in the United States was diagnosed in March, and it is now the dominant strain in the US. With this being said, unvaccinated people are at risk. In the US, there is a disproportionate number of unvaccinated people in southern states, including Alabama, Arkansas, Georgia, Mississippi, Missouri, and West Virginia, where vaccination rates are low. In some of these states, the number of cases is on the rise, even as some other states are lifting restrictions because their cases are going down. Kids and young people are a concern as well. A recent study from the United Kingdom showed that children and adults under 50 were 2.5 times more likely to become infected with the Delta variant, says Dr. Yeoman. And so far, no vaccine has been approved for children 5 to 12 in the US, although the US and a number of other countries have authorized vaccine for adolescents and young children are still considering them. Overall, my study is inconclusive because I didn't get enough opinions and answers on my survey.